Hi, we are Desogestrel, but you can call me D1.
And I'm D2.
We're basically just Desogestrel, but if you want to be formal, our generic name is Desogestrel.
If you want our branded version, you can get it as Mercet and Desogen.
Humans have middle names, right? To make them seem longer? But I bet you can't beat my chemical name. It's 13-ethyl 11-methylene 18-19-dinor 17-alpha pregn 4N 20YN 17OL. Don't worry, we won't expect you to memorize that, but it is important to know more about us, so I'll give you to D2.
Thank you, D1. Now let's talk about our drug classification. Our therapeutic drug classification is hormonal replacement. We replace the hormone progesterone when the body cannot produce enough of it. Our pharmacologic drug classification is contraception. We do that by inhibiting ovulation, therefore preventing pregnancy. D1 will now talk to you about how we fare with fetus inside the mother's womb. I don't think we're good at it though. Well, let her explain.
We don't mean to scare you, but we are not for everyone, and I will discuss that in our pregnancy category. I am category X. I could cause modified development of sex organs and limb defects. So if you're pregnant and you're asking, should I drink Desogestrel? No! Never! Desogestrels like us aren't very good with unborn children. But I promise, we're not all that bad. Right, D2?
Yes, you are right, D1. Now let me discuss our mechanism of action. Our effects are divided on reproductive and metabolic. Let's first discuss how we create a change in the reproductive system. The change that we create on the reproductive system are modification of luteinizing hormone, modification of follicle-stimulating hormone, declines on the onset of menstruation, and increased viscosity of the vaginal fluid. Moreover, the changes that we create on the metabolic processes are the increase in insulin secretion and resistance, increased lipase activity, and increased fat deposition. Our main therapeutic effect is due to our mechanism of action, which is known to be related to the inhibition of the ovulation in 97% of the cycles. Now that you know how we create the changes in your body, let's hear from D1 how we are absorbed, distributed, metabolized, and excreted.
Thanks, D2. Now let's talk about my pharmacokinetics. In my absorption, I am rapidly absorbed by the gastrointestinal tract with an absolute bioavailability of 70%. Time to peak plasma concentration is approximately 1 to 2 hours. Distribution. My plasma protein binding is 95 to 99%, mainly to albumin and in lesser extent globulin. We are metabolized by the liver and the intestinal mucosa via hydroxylation and dehydrogenation. I turn into active metabolite etonogestrel and undergoes further metabolism via sulfate and glucuronidine conjugation. Excretion via urine and feces with elimination half-life of approximately 30 hours. You might think that's all we do in your body, but you have to keep some things in mind, right, D2?
Indeed, you are right, D1. Here are our indications or the times that you may say yes to us. First is when you pair us with ethinyl estradiol. Second is when you take us orally. Now that you know what factors should be present before you say yes to us, let us now know when you should not allow us to affect you. D1, take it away!
Honestly, people should understand the importance of consent and the value of no. Because there are times when people cannot, should not, must not take Desogestrel. And these are the times when you should not, never take Desogestrel. I am contraindicated in people who have known or suspected sex steroid-sensitive malignancies because I contain the female hormone progestogen. If you're experiencing vaginal bleeding, which is undiagnosed, it is best that you go to a doctor before you take me. To avoid possible clinical errors, For people who have active venous thromboembolic disorders, I could possibly increase venous thromboembolism. Porphyria is triggered by birth control pills like me. Like I mentioned in my pregnancy category, pregnant women should never take me. You know how there are always two sides to a coin? The good always comes with the bad. I know I'm very useful, but I could be very harmful too.
Indeed, you are right, D1. As they say, you have to bring the good with the bad. By that, let's talk about our side and adverse effects. Significant side and adverse effects. Breakthrough bleeding. Progesterone breakthrough bleeding occurs when the progesterone to estrogen ratio is high, such as what occurs with us, a progesterone-only contraceptive method. Because of us, there is a lack of estrogen, making the endometrium thin and prone to frequent irregular bleeding. Venous thromboembolism. Studies show that the use of low-dose oral contraceptive like us and chastodine increases risk of venous thromboembolism. Hypertension. Patients who develop hypertension on oral contraceptives should stop taking the pill immediately and should be considered to have estrogen-induced hypertension. If it is only D1 and me, we cannot cause hypertension. However, we are indicated to be paired with our partner ethinyl estradiol, which can cause hypertension. In fact, as progesterone contraceptive are options for women who has hypertension either induced by estrogen or other causes. Systemic lupus erythematosus. Hormonal contraceptives are very potent hormones that has effect on the immune system. There is good evidence that HC use is associated with an increased risk of several serious autoimmune diseases such as lupus. Porphyria. Contraception is often a tricky subject for those with one of the acute porphyrias. Oral contraceptives like us are listed on the unsafe drug list. We are known to provoke attacks of acute porphyria either alone or by interacting with other factors. As pills, particularly the progestogen element, can trigger attacks. Asthma. Some pregnant women develop dark irregular patches on their face, most commonly on the upper cheek, nose, lips, and forehead. This is called gloasma. It is also sometimes known as melasma or the mask of pregnancy. Some women develop these patches when they take oral contraceptive pills. Depressed mood. Depressed mood and depression are well-known undesirable effects of hormonal contraceptive use. Depression can be serious and is a well-known risk factor to suicidal behaviors and suicide. Women should be advised to contact their physician in case of mood changes and depressive symptoms. Here, let's talk about our side and adverse effects on the sense of sight, digestive system, nervous system, and the reproductive system. Contact lens intolerance. Contact lens intolerance is a common condition in which contact lenses can cause pain and discomfort in the eye when worn. And judging from the redness of the eye in the picture, I'm guessing that it is really painful. progesterone pills can cause nausea. Some research indicates that progesterone and our partner estrogen can cause nausea and vomiting when we relax the smooth muscle, which changes the way that the stomach empties. Headache. It is important to mention that headache is a common side effect when you use as oral contraceptive pills, but it usually improves over time. Mood changes. When you use D1 and I as contraceptives, we will increase your progesterone level, and high progesterone levels are believed to be partly responsible for symptoms of PMS or premenstrual syndrome, such as mood swings. Ectopic pregnancy. Ectopic pregnancy is one of our rare side effects. If you get pregnant while using D1 and me, it can cause problem. You are more likely to have an ectopic pregnancy and won't be able to continue with your pregnancy. You may also need to have the fetus surgically removed. Breast pain. Although studies have not found any hormonal abnormality that explains a cyclical breast pain, estrogen and progesterone have stimulating effect. A few days before menstruation, both breasts may swell, become tender, painful, or lumpy. Irregular menstruation. The most commonly reported undesirable effect in the clinical trial is bleeding irregularity. Some kind of bleeding irregularity has been reported in up to 50% of women who use us. Since we cause ovulation inhibition close to 100%, in contrast to other progestogen-only pills, irregular bleeding is more common with us than other progestogen-only pills. Amenorrhea. Bleeding disturbances such as oligomenorrhea and amenorrhea should be investigated before prescription. Despite the fact that we are taken regularly, bleeding disturbances may occur. If bleeding is very frequent and irregular, another contraceptive method should be considered. If the symptoms persist, an organic cause should be ruled out. Dysmenorrhea. Many people experience cramps on birth control, especially when they first start using a new birth control method. People with severe or prolonged cramps may need to visit a doctor. The doctor can check for any underlying medical conditions and offer advice on switching to another method of birth control. Ovarian cyst. Some women can develop fluid-filled cysts on their ovaries. These aren't dangerous and don't usually need to be removed. The cysts usually disappear without treatment. In many cases, the cysts don't cause symptoms, although some women experience pelvic pain. Decreased libido. Birth control pills increase the liver's production of sex hormone-binding globulin, which literally binds up testosterone, effectively lowering the levels reaching the tissue. Lower testosterone gives lowered sex drive and can lessen the sensitivity in the clitoris and surrounding vaginal structures. Fatigue. Side effects including fatigue are in part due to the hormones in contraception. So birth control that is either non-hormonal or low in hormones can be associated with less fatigue. Weight gain. Most doctors would accept that some weight gain can be associated with a pill, and this is commonly quoted at 3 to 4 pounds. The reason for weight gain on the pill aren't known, but one theory is that the hormonal changes stimulate an increase in appetite. Oops, we didn't realize we can cause that much trouble. But don't worry, it is why it is important for you to seek your doctor on what contraceptive method you should use. Anyway, let's hear D1 talk about the nursing responsibilities before, after, and when you use us.
In administering me, the nurse takes on unspoken responsibilities. First, she has to know my uses. The nurse has to understand my purpose. what I'm going to do to her patient. Second is to assess and examine the patient. If the patient is experiencing my contraindications, give me orally. But if GI upset occurs in the patient, instruct the patient to take me with food. As I've said, I'm not very kind, so the nurse must instruct the patient what to do if I cause abnormal vaginal bleeding.